what is addiction? How does it start? And how does one know that they're addicted?
There are two types of addiction. You can be addicted to products, like substances, but there is also behavior addiction with betting, with the screens.
Why do many people turn to substance when they feel depressed, anxious, worried, alone? Why does that happen?
So for us, we call it self-medication.
You explain what psychosis is.
Psychosis is when you have three symptoms. One, maybe you have lost contact with reality. You can see someone out there without clothes, and he doesn't care.
Welcome to Imaginate, a podcast for you, a podcast for me, and everybody who wants to do better. This episode today is very close to home because these are questions that I ask myself. These are conversations that I often have with friends and people close to me. But today, I'm very, very blessed to have a professional to have a conversation with. And I'm hoping that you are comfortable and you are ready to listen and learn. Today's conversation is on addiction and things that come to us through addiction. There are things that happen in our lives because of substance abuse and other things that we can call addiction. So today, I want to learn what addiction is, and I'm hoping that you are curious to know what addiction is, because we hear that word a lot. And today we have a very professional person to take us through this conversation and educate us on what addiction is. Please, Edmond, welcome.
Thank you.
And introduce yourself. Let the listeners know who you are, and please.
Thank you for inviting me, and I appreciate being with you today. My name is Edmond Dufatanye. I am a mental health professional with different pathways that I've gone through to be where I am and have interest in addiction. So I started as a psychiatric nurse, and then I became a public health expert. And now I am about to become a group analyst. So I am a group work practitioner, and I do have interest in addiction. And I have worked in both psychiatric hospital and also at policy level. So I am pleased to be with you and to provide the little things that I know about addiction.
Yeah, thank you so much. For me, addiction is something, I don't know why I'm interested in that conversation, because I find myself doing research about those kind of things. I find myself having conversation with people about this, and I'm really, really honored that you made time to sit with me and have this conversation. And before we go there, you just mentioned group analyst, group practitioner, public health. Please explain to us, what's the difference? What does that mean?
I started by being a psychiatric nurse. A psychiatric nurse is a mental health professional who can work closely with patients from different disorders. When you are working as a psychiatric nurse, you can work in hospital, you can work in community, but you are not specifically working with a certain people, certain clients who are suffering from a certain type of disorder. But when you have interest in public health, it means you are overseeing about the health conditions. For me, it was basically in mental health. So we could have preventive measures. We could look at how the programs that are curative are being implemented, and also rehabilitative programs. But that time, my interest in public health is because of the work I was doing at one of the government organization. I don't want to mention that
Yeah,
one.
it's fine.
But it was still in the mental health field. But now, when you are asking about group work practitioner and group analysis, that is another approach of helping people from different background, maybe who might have had issues with their childhood trauma, who might have issues with domestic violence or alcohol or drug abuse, but help them to process all these challenges, but in a group setting. What I mean by group setting is that everyone who is in the group is basically helping the whole group in that process, because people share their personal experiences, their current challenges, past or the future worries, so that they can support each other. So it's something that you really experience. It's not something that I can easily explain.
Yeah.
But what I have learned is that people sometimes they share their own experience and they resonate with someone else. So that is where the healing takes place. Because you understand that I'm not the only one. And you can learn this person did this to overcome it. And I really accept that what happened to me, I'm the victim of the situation, but I have the abilities to continue living a normal life despite the challenges. So that is basically the essence of that approach of group analysis.
So what got you interested in mental health? Because your university education was in mental health, your bachelor's in mental health, and then you did your master's for public health. Like, what made you interested in that kind of trajectory?
That is a good question, but I would say that back in 2000, I think, when I finished my high school, so we were requested to do 2 years before we could enroll at university. But for mental health, it was open. You could graduate, finish your high school, and go straight to university. So then it means that mental health accepted me, because I don't know why, I didn't want to go to work and then come back to pursue my university studies. That is how it happened. But the other thing is, people who were ahead of me, who were my friends, they had already started to do mental health. But again, looking at how the country was recovering from the genocide against Tutsi, so I was thinking that, okay, if I am interested in the health field, so it's better that I have to understand people who are traumatized, because I have worked as an intern into surgical wards, and I wasn't feeling comfortable seeing wounds, but I was thinking that, okay, I can be helpful listening to people and supporting them in that recovery. Of course, I had little knowledge of how it is done, but I felt that this is the right place I have to be, and I enjoy it.
When I was reading a bit about you, I saw that you worked with Nasson, the late Nasson, and he has been a pioneer for mental health in this country, and worked so hard to change the stigma around mental health. How was that experience for you?
So for me, I consider him as my mentor. He has been mentoring different people, but at personal level, I have worked with him as my supervisor on monthly basis, And I could feel supported because working in mental health, it means that you are listening to most traumatic things that people come with. And sometimes you wonder if you have been helpful or not, whether you have been able to understand and to be supportive enough. So, and we always have to have someone who is knowledgeable, who is skilled than you, who you look up to be able to bring all the questions that you have. To say, okay, I am struggling with this client, we did this, and now I feel stuck. So that he can give you some insights. And that is maybe the person who helped me to still continue being the field and to enjoy what I am doing and to feel that I am really helpful to the people that I work with.
Interesting. At the time I got to know about him, unfortunately he had gone, but I remember seeing his interviews, the work that he has done for genocide survivors and the trauma patients, and that's something that I think few people knew about that. And he pushed and pioneered that, and I'm so glad that you've been close to him. Now he has mentored many people who are still with us, who are helping us. So let's go straight to our topic. Our topic is addiction, and please forgive my ignorance. And sometimes I just combine everything together because I think they go hand in hand. You correct me and guide me throughout the conversation. What is addiction? How does it start? And how does one know that they're addicted?
So there are two types of addiction. You can be addicted to products, like substances, but there is also behavior addiction with betting, with the screens. But let's focus first on the addiction with substances. So the substances we are talking about, they are licit substances and illicit substances. If we talk about licit substances, we can talk about alcohol, we can talk about tobacco and coffee. But these are licit. And if we talk about illicit substances, so we have cannabis, we have heroin, we have cocaine, and also we have alcohol, which are beyond 45% of alcohol volume. So, and addiction, to explain it, is when you are taking these substances and in your body, what happens in your body? Basically, addiction is what happens in your body because we have reward system. When we feel pleasure, like when we are taking food, there is a pleasure related to taking food. When it happens that you have sex, and when you are even connecting with people, when you are doing your work and you find that, okay, you made it, there is a project you have been working on and it has been successful, if there is a grant, so that there is a pleasure around that success. So, but when we talk about the reward system, it has helped the humankind to evolve, because when you are eating, so it means that if you don't eat, you die. So to reproduce, so sex has helped as humankind to reproduce, to have descendant. So now when we are taking other substances like alcohol or cannabis, the addiction that comes with is because when you take alcohol or cannabis, the reward system with some neurotransmitters like dopamine they are produced, but in the amount that is more higher than the natural dopamine. So, and then what happens is that the more you take alcohol or cannabis, the more dopamine are produced, the more you feel okay, you feel the pleasurable experience. But feeling the pleasurable experience while you are under alcohol or cannabis or other drugs influence, it means that your brain is informed that, okay, so to relive the same experience, I have to take to increase the amount. So when I'm talking with people, I ask them, how was it when you took alcohol for the first time? How many bottles did you take? So considerably, it's maybe
Small,
one bottle.
Yeah, small amount.
So,
Yeah.
But, so if you have been taking maybe alcohol for 5 years, so how many bottles are you taking now? How was would you remember the feeling you had for the first experience and now? So you see that there is an increase in terms of the amount to have the similar effect.
Yeah.
But the brain is still remembering the experience you have had.
For the first time.
The neurotransmitters, because when let's say if it happens that you are eating, I don't know your preferable food, but if you are eating, so there is a certain amount of neurotransmitters, dopamine, that is released in your brain. But however food it can be tasty, there is a limit.
Yeah.
But when you are taking a drug, it is a rush of dopamine that's coming. But the way our brain works is that when there is a big rush of dopamine, there is also other neurotransmitters that block, because it has to find a balance. So, and the addiction comes with the blockage of these neurotransmitters, because you have to have the limit, but also the irresponsiveness of the normal dopamine. So it means that once you are addicted, the other things that were pleasurable, they became like irresponsive. So things that we used to do, they are no more pleasurable, because the amount of dopamine that are released are now insufficient. So that is what happens in your brain.
So, in your experience, like from your knowledge, what kind of substances are being used in Rwanda now?
So I would say that I mostly talk about alcohol, because people think that alcohol, even though it is illicit drug, it cannot be devastating. So the most used is the most available, which is alcohol. So, and at the second position, it's cannabis. So the cannabis is also available because it can be accessible, when the accessibility in terms of even the cost, compared to heroin. So if you are like to have a map of availability of drugs across Rwanda, you are not going to find heroin, let's say in Nyaruguru or the remote rural area, because the drug dealers, they always plan to look for the clients who have the means to pay. So if the heroin is not produced in Rwanda, so it means that it is transported through different channels. Even though we know that police and other government institutions, are hypervigilant. But the drug trafficking is the second income generating illegal activity in the world. So meaning that, so they always change the way they can transport their product. Yeah. So it means that the first is alcohol, then the second is cannabis. So it's not only based on my experience, it's based also on research and data.
So what is the current reality of drug use and addiction in Rwanda?
So currently we do have data, but the source of data can be from different sources. Because they can be from hospitals, people came to seek help, but they can be also from NRIs, National Rehabilitation Services, where you find that there are people who abuse drugs, but also are delinquent, who have delinquent issues. But you can also find them into the police and justice, because there are some crimes that are associated with drug use. So, and also the surveys, national surveys. So the current data that we have, when we look at the national surveys, there is a survey that is going to be disseminated this year. There are some data which are preliminary data, which are not released yet. But the 2018 Rwanda Mental Health Survey indicated that like alcohol use is 1.6% in the general population. But it comes 3 times higher when you look at the genocide survivors. And other drug use, it is 0.6. So other drug use, it means cannabis, heroin, cocaine, and others. But you might think that maybe 1 point something or 0 point something is
little.
A little.
That's what I was gonna say.
It's over 100. So if you find that someone is having drug use disorder, one person over 100, so it's a huge number of people. What I mean by that is high, you can say, okay, can we compare with worldwide data? Or what does it mean when we look at the persons who are affected? Because if someone is affected and is maybe a father or a mother, so it means that the whole family is affected. Because addiction comes with not taking responsibility and not being productive. And addiction is a chronic condition. So even the care itself is expensive. So it means that you cannot really compare with worldwide, or you have to look at how the person, when the person is affected, how if the entire system is affected. So that is why we know that the government has put a lot of efforts into fighting, preventing, and rehabilitation. But the thing is, things are changing. We live in a society where there is a lot of pressure, and people have to learn how to deal with their stress, and also have to seek help, because addiction, from my experience, is never an isolated disorder. There is something that we call comorbidity, when someone is suffering from one disorder, but there is also, let's say, underlying conditions or other disorders associated. So that is what is tricky, and what we have to be aware in Rwanda, because in some places you might find that they are looking at the person who is addicted, but they don't know why the person started to use drugs. If the person was facing challenges of maybe divorce, it's something so hard to go through. If maybe we have older generations who have experienced the genocide, so once you have not received treatment, it means that you might find yourself looking for something that can help you, maybe to find sleep, maybe to feel like, okay, you don't have flashbacks. Flashbacks is the memories related to PTSD, to trauma. So it means that maybe the best approach is to look at the addiction as the tip of the iceberg and to go underneath to help the person comprehensively.
On that point, you said that in Rwanda it's 1.6 for alcohol.
Yes.
Alcohol. And you also mentioned genocide survivors. Like, how does that connect? How does trauma, how does pain connect with drug use?
Yeah, the trauma and drug use are things that are linked. Because if you look at the signs of trauma, so the person has experienced a horrific experience where maybe his own life was at threat, or he has seen beloved one being killed. So it means that our memory stays with such experience. And you might not find sleep, you might have nightmares, and you might have avoidance. You would like to avoid seeing anything that would remind you of such experience. And if you don't sleep, so you don't feel good, definitely. But the reason that you are not sleeping is because of the experience, the trauma. And if it happens that you take alcohol because it helps you to feel relaxed and to find the sleep in the first experience, so then you are self-medicating.
Yeah.
You are self-medicating because that is the only way you think. Maybe it's available for you to be able to cope with the trauma and the symptoms related to trauma. So, meaning that the number, which is 3 times higher between the general population and the genocide survivors, it's understandable in that context, in the clinical context.
Yeah.
So it means that people who, but the other thing that I have to clarify is that when we talk about 1.6, it is alcohol use disorder. These are people who are already having signs that there is an impairment. But there is also other people who might not be at that stage, but who are also abusing, like binge drinking. Binge drinking is when you are drinking a big amount of alcohol in a short period of time, and you might, if it happens that it happens all over on Friday, you might spend your Saturday recovering, and you are fine maybe on Sunday, and you go to work on Monday. In that case, you might not be into the category of alcohol use disorders, because they might not detect the tool used to qualify you as alcohol use disorder person suffering from alcohol use disorder. They might not really indicate that you had binge drinking, unless if they assess the binge drinking.
If they say, okay, how many drinks do you take a night? And they count and they tell you, hey, this amount of alcohol is considered unhealthy. How does that work?
So when we are talking about addiction, whether to alcohol or whatever, So there are normally 7 things that you can indicate that you do have an issue. First is loss of control. Let's say you are planning to have 1, maybe 2 bottles, but in the end, you end up having 10. You are planning to go into the pub at 7 and spend 2 hours. In the end, you stay the whole night.
Yeah.
You have lost control. That is number 1. Number 2 is persistent desire or failure attempt to cut down. You might find, okay, this alcohol or drug use is affecting my personal, family, professional life. I just want to stop. But in the end, you are not able.
It's not possible.
It's not possible.
Yeah.
So that is the sign, the second sign that you are really addicted.
Yeah.
There's also something called craving.
Yeah.
The persistent desire to use the drug.
Yeah.
And the third is tolerance. Tolerance is about increasing the amount of drug or alcohol to have the similar effect. Like what I was explaining earlier, that if you start using alcohol, maybe you started with 1 bottle, but in the end, you find that it is not producing the similar effect. You have to increase. That is tolerance. Your body is tolerating, is adjusting to the amount of alcohol or drugs you are taking. The 6th is withdrawal symptoms. People who are really addicted, when they try to stop, there are some signs. Here, young people, sometimes they call it tacky. That's the term they use.
Yeah.
They feel that they feel irritable. They might not have sleep. They might have the feeling that there are some ins that is around their body,
There's
and they
something
feel
working on your body or touching
they
you.
feel pain. So these are withdrawal symptoms because your body has adjusted to alcohol or drugs, and now it is craving. I need this to feel normal. So the other thing is neglect of responsibilities. You find that you are late at work. You are no longer caring for your family if you are married. You might just go out to take a drink or to sniff. So it means that your responsibilities as a student, as a parent, even as a boss, you are neglecting, because things that matter is only about the substance.
Yeah.
And the last thing is about continued use despite the harm. There are some people who are addicted, and doctors, they can tell them, oh, you know what? Among the treatment you have to get is to stop alcohol or drugs. But the person, because he's addicted, he understands that he needs to do it, but his body is not able. The reason why his body is not able is because the normal release of dopamine that the brain was producing when you are eating or having a relationship is insufficient. The person is feeling bored. And to be able to continue to live, he needs to take the substance. Yeah.
Yeah, that's a good point that connects me to the next question, which is, why do many people turn to substance, illicit substance, when they feel depressed, anxious, worried, alone? Why does that happen?
So for us, we call it self-medication, because when you don't feel good, let's say it can happen that you might have insomnia, you might not sleep well one night. But what if it happens maybe for a week? So you might decide to go to a doctor and get medication pills for sleep. Or if you don't do it, you take alcohol or another substance and you get the sleep. Okay, you feel, okay, this is
it.
This is it, and I have found a solution to the problem. But when I was referring to people who are traumatized, how they might have triggers. But when you are traumatized, it means that your brain associate some event to the trauma. So if there is a situation of a stressful event, so your brain is going to process it as having a reference to the trauma event, which is really strong enough for you to find that you are not able to cope. So it can be like one way of soothing yourself. You turn to drugs because you find you have strong emotions related to the past traumatic experience, and it is a short-term solution with long-term consequences. Because in the end, when you are addicted, people are going then now to blame you. So,
and our society does that a lot. Once you fall into addiction, they start blaming you, and sometimes they blame your family. They blame everything on you.
Yeah, our society is likely to look for why.
Why?
So, and they might say, okay, you have had good opportunities. So you have attended good schools.
Yeah.
So, and
that's actually how they look at it. Like, your parents are rich.
Yeah.
Why are you taking drugs?
Yeah. So the society have to be aware.
Yeah.
That the determinant of alcohol use or drug use, I just need to move and talk about it because it's very important for people to understand. So when we are young, we do need to have a secure environment. So with our family. But because we live in a society where we are in a transition, sometimes our parents are not there. So, and how do we experience absent parents? How do we experience being raised with nannies, maybe who are, I would say, present physically, but absent emotionally. So that emotional absence, how does it affect us when we are young? So the childhood insecurities, if parents are fighting, how does it affect us? If we are maybe 4 or 5 years old, so we see scene of violence in our families, how does it affect us? So, and also, what if it happens that there is a death in our family, like stressful life events? What if we fail maybe at school? How does it affect us? What if there's a divorce and you have to live with a single parent, mother or father, or you have to have a new partner on your father or mother's side? So how do we cope? And we have to remember that we are young. So maybe we might find that we have inconsistent caregivers. A nanny is going and there is another one. So you don't have a reliable emotional person to grow emotionally, to be strong enough to cope with other stressors that you will come across, maybe during adolescent or adult age. So, and also there is community peer pressure. So when we think about community now with the modern technology, so it's so hard to define our community.
It's very hard
because we have community that is online. So how does that community protect us? Because we have to have protection from the nuclear family, the extended family, and the community. But now the community is not about your neighbor. It's not about your teacher or whoever who is close.
It's a global community now.
So is also global and online community. So I think that there is a lot of pressure, and that current pressure based on your young age and based on how you have had maybe emotional stability. So it can lead to someone not being able to know how can I cope. So, and not knowing how I can cope, it might lead to substance use. So that is what can be a challenge now. And we have to not blame, because we're talking about how the society can blame and look on one side. So you have been in good schools, your parents had everything, but the materialistic things, I don't think that they make a person.
Yeah.
So the emotional things, they really help the person to grow and to face any challenge.
Yeah. When we're still on that topic, please explain to us what self-medication is and how does it lead to addiction?
Because
maybe I can give you an example. Alcohol is an antidepressant in a way, because if you feel some type of way, you take it, you feel normal for that time. You feel the confidence is back. You feel relaxed. You feel more of yourself. Some people say, I'm honest when I'm drunk. You know, like when I drink, that's when I can tell the truth. So that looks like a tool to cope with normal life in the beginning. And then, is that what we call self-medication? And how does that lead to addiction?
So we use the word self-medication when someone has already some challenges that we can even look at them and say, okay, there is an underlying disorder. Because some people, they might use alcohol as a recreational use when they have maybe had a stressful day at work, but they don't have any problem at home, and they feel that the only way they can connect is with other people is meeting in the pub.
Yeah.
So that is not self-medication, but it means that it's a recreational use. But self-medication is when someone has an underlying condition.
So, like, if I'm getting you well, if someone has an issue going on before substance.
Yes, there's a problem, and that problem you haven't been able to deal with it, and then you find that the problem has had consequences on you. The way you feel, the way you think, and the way you are able to cope with the daily stresses. So if that problem has impacted you, and you try to find a solution through alcohol or drugs, that is what we call self-medication. Yeah, that is how I can explain it. But all people who are in the pub, that doesn't mean that they are self-medicated.
Yeah.
It is all about the reason why.
Why are you drinking? Why are you smoking? Why are you taking all these drugs?
Yeah.
So is there, right now as we are on that point, is there a question that you would share with someone for them to assess where they stand, maybe psychologically or clinically. Like what questions would someone ask themselves to assess, really, am I self-medicating, or I'm just drinking or smoking recreationally?
So normally when we work with people, I would say there's two ways we do work with people. One is when we are doing a mass screening, and we can provide alcohol use disorder screening test. And based on the score, we can look at some of the questions that maybe the person responded to say, okay, it means that maybe the way you are drinking is a risky drinking. Let me give you an example. If I ask someone, have you got into trouble with a legal system because of the way you drink? Okay. So the person might say yes, and they can explore what happened. Maybe the person might say, okay, I did drink and I took a car and I had an accident. So it means that the loss of control is already there. And when was that? Maybe it was Sunday at midnight. So, and I was about to go home and take a rest and go to work on Monday. So that itself is an indicator that the person is really in trouble with addiction. But I wouldn't say that it is only one question, because we have to take time to understand since when the person started to drink, and how, what amount of drinks that he might take, the frequency, whether he drinks alone or with people, or whether he knows the amount of money he spent with his drinks. So whether he has had other incidents. So it is not only one question. It's in a number of questions, because even you have to take time. When I am working with someone, for the first interview, we have to spend 1 hour and a half.
So 1 hour and a half.
So to have an understanding of the underlying conditions that might be undiagnosed, but also to have a clear picture of the problem the person is bringing. And if we will have to also prescribe, because if someone cannot sleep without taking drug, so it means that you have to also support the person. You can't withdraw the drug without having something to help the person, because that is his unhealthy way of dealing with the problem.
So do you replace a drug with another drug?
Yes, because the person is suffering. Staying the whole night without finding sleep. So what comes to your mind if you have been traumatized? So you are going to go back to the period when maybe you were running so fast that people won't kill you. So it means that there is a lot. It's not only about not sleeping, it's also what happens when you are not sleeping. So, and also the person might have tried different things. It's basically being on your side to support you to go through that process. I cannot go on your side without understanding the challenges you are facing.
Yeah, and I think that's what I would
encourage. So it's not about replacing the drug with another drug. It's about supporting the person to go through the crisis the person is going through, And also, there are also the times where I can agree with you, because it all depends on the type of drugs you are using. Because I have said about withdrawal symptoms, some might be very painful, and some might even be life-threatening. So, and when you are in the hands of medical personnel, so they can replace with other drug, but in a medically controlled way. If our public or audience should understand it. But saying that it's replacing drug with another drug, maybe people might misunderstood that, okay, we are promoting drug use, but it's all about how our brain has been used to the drug, in understanding that when you take away the drug, the body will react, and withdrawal symptoms can be life-threatening.
Yeah, because we have talked about like extreme situations like trauma, things like that, but we also have people who start drinking or smoking as just for fun, and then it becomes a habit. They're not running away from anything, but they're like, I haven't smoked today, I have to smoke. I have to drink today, I have to. So it becomes more of a habit. What happens in that case? Because the trauma side is like you're looking for peace in that sense. But what if someone just tried drugs once and they like them, and now they feel like they have to take them every day?
Yeah, it's good that you're asking such question, because nowadays, with peer pressure, people might say, okay, we are young, we earn money, and it's cool to go out on Friday or Saturday. But what I have learned from people who have used heroin, what they said is that from their experience, heroin, it's never touch. Even those who don't speak English, I was surprised they used the word never touch, never taste, never experience even once, because heroin is very addictive. So, but if people do really use alcohol in a recreational way, so I would first say that you have to be mature enough. For me, personally, legally, you have to be above 18 years old. But for me, I would advise to be more than that, 21, because of the science around brain maturation. So it is well known that brain maturation comes around 21 years old for the average, but for some people they can even be more than 25. And when you start to take alcohol, the time your brain has not reached the maturity, that is where there is more risk of addiction. And the last part of the brain that develops is the prefrontal cortex. That prefrontal cortex is the one that helps us in decision making. And imagine that your brain is going to not be able to process information to take decisions. So that becomes a problem. So if you are able to not lose control, and you are able to understand that, okay, we are going to have fun with friends. Maybe I am 23 years old. I'm going to go out and to hang out with friends up to, let's say, to 10 p.m. and go back home. That's fine. If I don't drive. If I have a car, I will have musare. So that is fine. It means that you are in control. And you are thinking about the next day, you have some work to do. You are working on the project. That is fine. So, but if it happens that you are not then in control, the amount of alcohol you were planning, you exceed that amount, the number of hours. So it means that you have to be aware that something is not going on well. You are no longer possibly in the recreational use.
So that's how you can gauge if you are using recreationally or you are heading to addiction.
So when we are talking about recreational use, it's all about licit. Don't talk about recreational use when we are talking about illicit.
Yeah, illegal drugs, they can't be used recreationally.
Illegal drugs don't use recreational. So
then we are left with legal drugs, which is alcohol,
tobacco, and coffee.
And why do you consider coffee a drug? Because you're putting coffee in the same category with alcohol.
So some people, they don't know that coffee is also addictive. It can be surprising.
Yeah.
Because if you go into books, you will find caffeine-related disorder.
Oh, wow.
Yeah.
There's caffeine-related disorders?
Yes.
What are those?
So, and you will see that there are some coffee shops around.
Yeah, so like, if it's a drug, why is it everywhere like this?
No, it's licit. It's not illegal. But when you are addicted to caffeine, you might also lose control. I had a story of a woman who was pregnant, and she had high blood pressure, and the doctor said, never use coffee. And she passed by a coffee shop, and she had the smell, and she was driving. She lost control. She was not able to continue drive. So would you say that is not loss of control?
Yeah, it is. It is. I'm very careful to say it's addiction, but it's a sign.
No, it's you. I would ask you to go and read. We cannot say that someone who is addicted to coffee is similar to someone who is addicted to heroin.
Yes,
but caffeine is addictive.
Yeah.
So if it is addictive, then people should be aware that the amount of coffee they are taking can also impact how they function. Yeah, that is what people should know.
Yeah, I think for those who are listening and watching, the encouragement is to read, do research, and know that even things that you think is safe sometimes it's not safe.
Yeah, but coming back to your question about coffee, we don't see a big number of people who came for therapy because they are addicted. They do have issue with caffeine use. But as what we know now is coffee is addictive, and the people have to be aware of it. Don't give it to young kids, and be aware that maybe even the expenses. If it happens that you record your expenses, if you are addicted, you are going to see that coffee is one of the things
that's taking so much money from you. But there's also this saying of like anything's addictive. Some people can be addicted to food, to sleep, to water, to all these things. What do you say about that?
Somehow, I would say that people might be addicted to different things, because if you are spending, let's say if you are spending 2 hours, you are a student, your plan was maybe to stay 20 minutes on social media, and you are preparing an exam, but in the end you spend 2 hours. So it means that there is a nudge of using the social media and you are not in control. But if it happens that you fail that exam and your next exam, you put away your phone or whatever, you concentrate, I wouldn't say that you are addictive. So maybe you are aware of how you are not able to control, but this time around you are able to control. So, but being addicted to things, it's all about the amount of time you spend. It's all about how you can control. And it's all about how it affects your other area of functioning. Does it affect your professional life, family, personal life? So if it does, then that thing might be addictive in your context. But there are big things that have been considered, accepted medically in medical field as addictive.
So now let's go to mental health. How does long-term use of substance, either alcohol or illicit drugs, affect the mind, the mental health, our mental health?
Yeah, the first thing is that through taking these drugs, your brain reward system has been hijacked. So you are no longer enjoying the basic things. Like if you are preparing your podcast, so you are excited, you don't know who's the guest, how the talk is going to be and how people are going to be interested. So there is some pleasurable neurotransmitters that comes with that excitement. But when you are using drugs, so it means that the excitement level that you were produced with that podcast production is going to be less, because there is something else that has changed the way your brain process the pleasurable activities. So it means that in the long term, you are going to find that when you are doing something, you are bored. Nothing really matters. Being with people, it doesn't matter to you. Taking care of yourself, it doesn't matter. Eating, it doesn't matter. So then people will see that you are no longer the same person, because you don't care about having a party at home. There are old friends who are around. So for you, if you are in your room and you are taking whatever, that is what matters. So it means that you are no longer the same person. So, and sometimes with some people, based on the type of drugs they are taking, they might find themselves having mental disorders. Mental disorders in terms of psychosis, you can have psychosis. You might start hearing voices or things that are not there, seeing things that other people are not seeing, thinking in a way that people wouldn't really understand what you are thinking, having delusions. So, but it all depends on the type of drugs. But if I come back to alcohol, which is widely used drug, so people even might lose their taste because their neurological system is affected. And you know that there are people who say, okay, if you have a guest, they might say, okay, what can we prepare for you? Say, okay, no, for me, don't worry about what to eat, as long as there is something to drink. So they might be malnourished, with the consequences of having liver damaged, cancers, heart disease. So physically they are affected, but mentally also they can be affected because the brain, which helps us to process the emotions, the thinking. So you might have people who forget, what we call amnesia, but at the same time, decision taking. So it means that long-term effects can be for both physical and mental, but socially, family-wise, professionally. So it means that the person is really affected on all areas of functioning.
Yeah, I think for alcohol, we have had enough time to observe families, friends, like people we know being affected by alcohol in both physical and mental. But one thing that we hear is cannabis. Cannabis is not considered in many places like a dangerous drug because they say it's not addictive, it's natural. What are some of the consequences in your experience, the things you have seen of the effects of cannabis?
So you are using in many places. So that is not, cannabis is not considered in many places as dangerous. But let me use the experience I had with someone when I was doing internship in Belgium. He told me that cannabis, the effect of cannabis depends on the concentration of THC. THC it's the tetrahydrocannabinol, which is the active ingredient of cannabis. He said that THC varies based on where the cannabis has been planted, where if it has grown up in, has been cultivated in Africa, in a climate that is hot, THC can be high. But if it is grown in Europe, THC concentration is low. But he also explained how the THC can be a psychosis trigger for someone who is vulnerable.
You explain what psychosis is, because
so psychosis basically it's a mental disorder that is, you can say that is, you can recognize psychosis because there are different types of psychosis, psychotic disorders. But psychosis is when you have three symptoms. One, maybe you have lost contact with reality. You can see someone out there without clothes, and he doesn't care. You have lost contact with reality, and you might have hallucinations. So you are seeing things that are not there. Whether you are seeing them, whether you are hearing them, even you can feel on your body that there are things. Even the taste can be different. That is on the part of hallucinations. But you can also have delusions. So delusions is when you have a thinking which is not also which doesn't match with reality. So you might say, okay, you might hear someone saying, okay, so I am. Sometimes it also change based on the current situation. I'm the Pope. If there is maybe election of, I don't know if Pope are elected, but if there is a change and the person is really a Catholic and strong believer, he might have delusions in that way. He might say, okay, I'm the president. So I am whoever, a famous person. So he's really convinced that he's that person. He's having delusions.
So that's psychosis.
That's psychosis. Briefly talking about psychosis, these are the key features.
Is that what we call ibisazi out here?
So most people, they refer it to ibisazi, but I don't like to use that word. But because historically, with the evolution of mental health, mostly people were not getting early treatment. And you might find that people, once they are not treated, then their disorder evolves to not being able to function in that way. Yeah, that you cannot have psychosis and be difficult to be recognized.
It's someone can look at you and
there's a behavior change, definitely, that people will recognize it.
So, do you have those cases in your practice where you see people come to you or you treat patients with psychosis?
So I have had them in the past. Having people who might have a brief psychosis because they have used cannabis. And then what I mean by brief psychosis is that they might have these 3 symptoms, but in the end, they recover. Because there were some vulnerability to their mental well-being, and then they took cannabis, and then they had crisis. But once they stop cannabis, you might find that they continue functioning. But there are also other people who were maybe vulnerable, having family members suffering from other psychotic disorders, and maybe they had hallucinations as the initial signs, and they used cannabis, and then they had really psychotic disorder. So in that case, you might find that there is comorbidity. There is, maybe the person was also going to have psychosis without using cannabis, but the cannabis precipitated the psychotic episode. So sometimes it can be challenging to know whether, if this was not present, if the effect, the result wouldn't have happened. But what is known in the literature is that cannabis can be the cause of psychotic disorder. But also, people suffering from psychotic disorders, sometimes they use cannabis as self-medication.
Like you feel like you're about to lose your mind, then you take the drug to self-medicate.
Yeah.
Now, how it sounds like there's no one size fits all. One person can have the psychotic episode without using the drugs. Another person can use the drug and not have the psychotic episode, or use the drug and have the psychotic episode. How do we take care of our mind? Because it's the most important tool we have. How do we take care of it?
So there are some things that we don't have control over them, like the family we came from, how our caretakers understand what I have explained about being taken care by nuns. But we have to be aware that the materialistic things are not the things that we need when it comes to understanding mental health, how we can be emotionally stable. But taking care of ourselves, it all depends who has that responsibility, because parents, they have their responsibility over their children. Other people, they have the responsibility over themselves and also over beloved ones. But taking care of yourself, I would say that you start by recognizing whether there are some unresolved issues in your past that you have to work through. That is the first step, because I am thinking about the context of our country. So if there are traumatic events that you have experienced, it's better that you really work on them before you start self-medicate, or before you find yourself being an adult, a responsible parent who is not able to care for his kids or his family. So it means that seeking help is one way of taking care of yourself. The other thing is about knowing the healthier and unhealthy ways, because if you are self-medicating, this is not a healthy way of dealing with your past stressors or current stressors. And there is what we call a wheel of wellness. It includes physical wellness, well-being. It includes emotional. It includes work-life balance. It includes social, spiritual, and financial. So sometimes even finance can be a stressor. So when
Not
you
sometimes, most of the times.
Okay. Because it's all about how the type of stress-related financial-related stress you are having. Because if you are working and then you have an emergency of maybe being sick, and you have to spend a big amount of money, so it's different from how someone who has some millions of loan. That is an example. So it's financial stress, but the context is different. That is why I'm saying sometimes. So, and yeah, you have to consider all these aspects. It's not only about taking care of yourself emotionally. You have to look at the relationships. You have to look at the work-life balance and the finance and the physical. So if you see people going out exercising, it's not only about the physical, it's also the mental they are working on.
So for for someone who doesn't know what mental health is, what tools would you give them to use to take care of their mind? Like, you can list them. You mentioned physical exercise, but can you mention like a list of things someone can do to at least try to have a healthy mind?
Yeah, I did say that the physical part, when you are, the physical part, it includes eating healthy meal, exercising. So whatever you are doing to take care of your own physical health, it also contributes to the mental well-being. That is one. The second one is emotional well-being. Recognizing what are the stressors that you are facing, how these stressors might be related to your past experience. So do you really need to go to see a professional so that you can process these past traumatic experiences? So financially, so how do I manage my finance? So how do they work as well? So how do I organize my work? How do I find a work-life balance? Spiritually, so spirituality has also a big part. So all this combined, it is one way you can really take care of your mental health. Because mental health is how well we think, we feel, and we connect with people. So it is about the clarity in our thinking and recognizing when you are sleeping, because it's not always that your emotions are going to always be good, but it's very important to recognize when something is not going on well, and you can accept the situation. You can either increase the amount of exercise you are doing and do things that you know that really helps you to go through these challenges without really using the unhealthy coping
mechanisms.
Yeah.
Now, on our topic of addiction, is addiction treatable? Is it a disease? Is it how would you categorize addiction?
So addiction is a disease, it's a disorder. It is treatable, but it's a chronic condition.
What do you mean?
What I mean by chronic condition is that if you are addicted, you have lost control, you spent a sufficient amount of time either searching or recovering the effect. So you understand how the brain has been hijacked, how the normal, the natural source of pleasure is no longer providing pleasure. Imagine if you had no pleasure in doing this work. How would life be? So it means that you have to recover. And the recovery is a long process. And it implies a lot of things. So what I'm saying that it's treatable but it's chronic is that even people in their recovery process, they might relapse. But there are terms that are used by professionals that they differentiate relapse and lapse.
Relapse
and lapse.
and relapse.
Lapse. Yeah. So
What's the difference?
let's use an example of someone who is recovering from alcohol use. The person maybe has been sober for 5 years, but there is something that happened. Maybe it was a trigger that happened, and he had planned not to take alcohol, but he took alcohol that night. But the following morning, the person might think, okay, why did I took alcohol while I have been up sober for 5 years? So if the person continues, so it means that possibly he has relapsed. But if he doesn't continue, we consider that as a lapse. So it means that it's isolated event that has happened, but the person is going to continue his recovery process. So meaning that the condition which is chronic, the people who are in the recovery for alcohol, they always say, what they have shared with me is that in the first stages, they consider 1 hour as a success, and sometimes they consider a day as a success, sometimes they consider a month as a success, and they don't spending 5 years with being sober doesn't mean that for them things are over. They keep on thinking about how they can continue to be sober for the next year, the following year. So, because there is a lot of triggers. Seeing a bottle, smelling the alcohol, being with friends who are taking alcohol. So the pleasure that was related to alcohol is still in their memory. So meaning that their brain remember the pleasure that was associated to that drug, and also not having the normal natural reward system functioning as before. So that is what makes the addiction as a chronic condition.
Because the triggers are always going to be there.
The triggers will always be there. Your brain does always remember. And the reward system has been hijacked for that period. And you are not sure whether it is going to be back to its normal functioning. So that is why we call it chronic condition.
Okay, so let's say someone is addicted to either illicit drugs, alcohol or cannabis or heroin, and they come to you. What does the process look like? Let's say someone is struggling and they come to you as a professional person. How does that look like?
Okay, the first thing is like there are things that I can do based on the condition they are suffering, but normally I behave the same way as I am working with someone else. It means that I don't judge the person. I have to listen. I have to understand whether the person is suffering from both addiction or other disorders. So I have to understand whether the person is how motivated is, because when you are working with someone who is suffering from addiction, so motivation is key, because you are supporting the person in that process. And if the person is not motivated, so you cannot have results, basically. Sometimes people, they come to seek help because it is the family that is behind.
That's forcing them to go seek help.
So, and normally what happens, that process fails.
It doesn't work when
when the family is like, okay, we are going to do everything for you to be treated. I can help the person, but there is some barriers. I can work with the person to motivate, to explore his personal beliefs, the values that maybe do contradict with drug taking. So we are going to work on the motivational aspect when the family is pushing. But if it happens that we don't reach the point where the person is himself motivated, then we can consider that we have failed.
So
we cannot move to the second stage.
For someone to be treated, they have to be motivated to change.
Definitely.
No one can take you to a therapist. No one can take you to get treated if you don't want to be treated.
Definitely. Because you can be taken to a therapist or a mental health setting, stay there, but the time you are discharged, then you go back.
So what role do family and community play in recovery?
It's a very critical role, because whether motivated or not, the person has to feel supported, not judged. And the support is a continuous support. So if maybe the person would like to take distance with the routine drug-related behavior, and you would like to enroll into maybe, let's say, a university course or going back to school, so that is where the person has to be supported so that he can regain the control over his life. So it's very critical.
But also there's also that stigma, there's also creating an environment that is not comfortable for the person. So I think the family plays a big part also to create that environment where someone would feel seen and heard.
Mm-hmm. Yeah.
Because family can want to help, but in that process they can also be triggers. They can be the ones who are triggering that behavior to come back again.
Yeah, what I would comment on the support of the family is that the family has also to be supported so that they can support their beloved one. And the support has to come with information, psychoeducation related to the condition the person is suffering. So if they see lapse, they don't have to consider as relapse. So there are a lot of things to work with the family of people with addiction to be able for them to support them. But stigma can be from even the person who is suffering, the family and the community at large. So, but once you know that you are supported, I think you feel less stigma than someone who doesn't feel supported.
What is the first step that someone who wants help has to do or can do?
So the first thing is to accept that you need the help, because sometimes people try to help themselves and it doesn't work. And when it happens that you reach to that point, you have to recognize that there is professional help. Because all people who came to see us, they have tried. But trying without recognizing that there are things that maybe are related to your past experiences, that they are triggers, so you are doing it alone, you are being stigmatized, so it's so hard to process all these things while you are alone. So it's very important then to accept that, okay, let me reach out to professionals and get the support. So there are professionals around the country at the health centers, district hospitals, and the specialized institutions. Even we do have professionals who are in private, like Solid Minds and others. But it's very important to know that professionals will not judge you. We'll accept that the conditions itself is hard for people, and you need the help during that process. Thank you.
Well, thank you so much for your time, Mr. Edmond. I hope people who are looking for help with this issue of addiction and mental health have gained some insights and know how they can really seek help. Yeah. So any last thing you would want to share with someone from your experience?
I would say that we do face different challenges in life, and we don't have the same capacity to cope, and it's normal to seek help. If you do have any physical illness, you are not ashamed to go to see a doctor. So what if you are feeling mentally exhausted? So it's better to also to recognize that we do have help out there, so that you can reach out and get the support. Thank you.
Thank you so much.
You're welcome.
And thank you so much for listening.